Hi, I'm Dr. Jill Rathus, and I'd like to tell you about the family violence concentration here at CW Post in the Clinical Psychology Doctoral Program. The concentration in family violence involves a full year elective sequence that covers child and adult problems of family violence. Some of the topics include child abuse, physical, sexual, and emotional abuse of children, perpetrators of child abuse, adult survivors of abuse, intimate partner violence, and elder abuse. In addition to those basic topics that are always covered, we have a variety of special topics that we cover based on the year, based on student interest. And those have included topics such as school violence, bullying, teen dating violence, gang violence, rape, workplace violence, adolescent sex offenders, trauma in general, and even terrorism and genocide. In the family violence concentration, people learn about the research, theory, and treatments of these various problems. The student will learn a lot about diagnosis and the diagnoses that are particularly relevant for victims and perpetrators of family violence. So they'll learn to assess for these diagnoses and treat not only the specific problem of family violence, but the diagnoses themselves. So some of the common diagnoses we see associated with family violence are Axis 1 disorders like mood disorders, anxiety disorders, particularly PTSD, substance abuse disorders, and others, and then of course the Axis 2 disorders. So as I said, students will learn assessment of the various problems associated with family violence and specific treatment approaches. We emphasize treatment approaches that have empirical validation, but we also discuss a range of treatment approaches, and some might have less scientific support than others, but we definitely include the ones that are supported by research. So for example, students will learn a great deal about trauma-focused CBT, they'll learn about motivational interviewing, they'll learn about the Duluth model for intimate partner violence, and then they'll learn related treatments such as parent training and many other models that have been used with these populations. In addition to the topics I mentioned, the courses often emphasize problems of intimate violence in special at-risk populations. So for example, we've covered multiply traumatized populations, including those with chronic PTSD, the LGBT community, immigrants and ethnic minorities, substance abusing populations. These types of populations are all more complex to deal with when there are also problems of family violence going on, so we address those areas as well. In the concentration in the courses, students have done a variety of special projects. These have ranged from things such as going to a local hospital and sharing courses with the medical residents in training in these topics. They've included putting on a family violence educational fair for our entire department. They've included book sharing projects on books that specialize in these topics that are current important books in the field. They've included putting on mock trials, debating some of the many controversies in the family violence field. So the students have a chance to really learn with hands-on, experiential, and creative projects, as well as traditional didactic methods. We also have concentration meetings. Every concentration in our program has a concentration meeting each semester where we either bring in guest speakers who are professionals working in the field of family violence, or they are experts or expert researchers on a particular topic, or one of the faculty members will present on a related topic, and occasionally we've even had our students put together projects and present them. And these are presented as colloquia now to the entire department. So everybody gets an education, a basic education on family violence, but our students will have a chance to be closely involved in these as well. And we've had topics ranging from people coming from agencies, such as agencies helping people involved in commercial sex work, people coming from agencies helping LGBT youth involved in problems of violence. We've had people come from forensic settings like Rikers Island and talk about family violence populations and their treatment in settings such as that, and a host of other types of speakers. We also have students doing dissertations in the family violence field. And students in the family violence concentration have the option of doing their dissertation in a field directly related to family violence or not. They can certainly do a dissertation in another field or sometimes a related area. So students have done related topics such as things involving family therapy or couples therapy or something in substance abuse, and then many students in the concentration do dissertations directly related to family violence. Some of the faculty, such as Eva Feinler and myself, have had access to data sets involving treatment programs such as aggression replacement training, and students have used these data sets and found ways to do dissertations with these. Students have also collected dissertation data at various sites they've been working at that may include family violence presentations. Sometimes the students work with the faculty and our research on family violence, such as a lot of my work on intimate partner violence and subtypes of intimate partner violence, and using DBT to treat problems of intimate partner violence. Students have worked with me on those things, and then students have also done other topics of interest to them relating to child trauma, adolescent problems of bullying and school violence, training teachers to be prepared for violence in the schools, and similar topics. I wanted to say a word about training sites affiliated with the family violence concentration. As you may know, our students go on 2 or 2.5 day a week externships in their 3rd year and their 4th year in the program, where they go to external sites for training. And in their 5th year, they do a full-time internship at a clinical site. And some of our family violence students have gone on to find specific training sites where they can work in a focused way with family violence populations, such as units that they have related to this at the local site, North Shore University Hospital, or at a local agency such as the Victims Information Bureau of Suffolk. Or many other students go on and do externship and internship training where, while they're not working specifically on some type of family violence unit, they encounter problems of family violence very often, simply in the range of populations they're working with in inpatient settings, day treatment or partial hospital settings, or outpatient settings, in a range of places, including even college student counseling center settings. So the key is that once our students have had the training from the family violence concentration, they become really expert at detecting family violence, knowing how to assess the problem, understanding what problems they can expect to see come up with their patients when they're in situations of family violence, and knowing much better, feeling much better prepared how to intervene with these populations, since family violence is a very prevalent problem and is very highly represented in the populations that we see presenting for treatment. I always like to remind our students applying to our program that our concentration areas allow students to obtain an additional focus to their training. So they come out with a specialized area that they've really gone in depth and learned about, but that this comes on top of our broad training in clinical psychology from both the cognitive behavioral and a psychodynamic approach. So it's broad, complete training in clinical psychology and then an added area of specialization by choosing one of the concentration areas. If potential applicants would like more information about our concentration areas or about the family violence concentration in particular, first I'd refer you to our website, which gives a great deal of written information on the family violence concentration. You're also welcome to contact one of the student representatives listed on our website and ask them about their experiences. And lastly, you're welcome to contact me, Dr. Jill Rathus, as the director of the family violence concentration. Thank you.